Imagine waking up in a world where half your neighbors are dead, where the priest who was supposed to give last rites died before the people he was meant to comfort, where bodies pile up faster than graves can be dug, so they're just thrown into pits, layered with lime and covered with dirt, where the fundamental assumption that tomorrow will look like today has been shattered so completely that nothing, not your job, not your government, not your understanding of how society works, will ever be the same. Now imagine that 50 years later, your grandson is living in a completely different world. The Lord who owned everything, his great-grandson is desperate for workers and offering actual wages. The rigid feudal system that seemed eternal, starting to crack and crumble, cities growing, trade expanding, art and ideas flourishing in ways that would have been impossible before half the population died. This is what pandemics do. They don't just kill people and then fade into the history books. They reach into the machinery of civilization and rewire it. They force societies to rebuild from the foundation up. And when they do, the world that emerges looks nothing like the one that existed before the dying started. We've been through this before, multiple times. And every single time, the world that came after was not the same system it had been before. The Black Death killed feudalism in Europe, even as it killed 30 to 60% of the population. Smallpox didn't just devastate the Americas, it enabled conquest, forced the creation of global health systems, and became the only human disease we've ever completely erased from existence. Spanish flu hit the world at the end of the First World War and killed more people than the war itself, but in ways that reshaped how governments think about public health forever. And COVID-19. We are still living through the rewiring, watching as work, cities, education, and state power transform in real time. If you're here because you want to understand how diseases don't just interrupt history, but fundamentally redirect it, how the worst moments of human suffering somehow become catalysts for massive change, you're in exactly the right place. And if this kind of deep historical analysis is what you're looking for, subscribing helps me keep making them. This is the story of 4 pandemics that punched civilization in the face, and how the world that got back up looked completely different from the one that went down. Let's start in October 1347 in the port city of Messina in Sicily, because this is where Europe's encounter with the plague begins, and understanding what happens in the first few weeks tells you everything you need to know about how quickly a society can come apart. Ships arrive from the Black Sea, and the sailors are dying. Not normal sick, dying with black swellings in their necks and groins, fever that burns them alive, and strange dark blotches spreading across their skin. Within days of these ships docking, people in Messina start getting sick. Within weeks, they're dying by the dozens, then hundreds. The city authorities panic and try to expel the ships, but it's already too late. The disease is loose in the city, spreading from person to person, house to house, street by street. And here's what makes this different from a normal outbreak. It doesn't stop. It doesn't burn itself out after hitting one neighborhood or one city. The plague spreads along trade routes, following the roads and rivers and shipping lanes that connect medieval Europe's economy. It reaches mainland Italy, then France, then Spain. By 1348, it's in Paris, in London, in Germany. By 1349, it's in Scandinavia and Eastern Europe. By 1352, it's reached Russia. In 5 years, this disease crosses an entire continent and kills somewhere between 30 and 60% of Europe's population, perhaps 50 million people worldwide. Think about what that means in practical terms for a moment. You're a peasant in a village of 200 people. Over the course of 2 months, 100 of them die, maybe more. Your family of 8, 4 survive if you're lucky. The extended family network that you've relied on for help planting crops, for sharing food in lean times, for watching children while you work. Half of them are gone. The village leadership, the craftsmen, the people who knew how to do essential things. Many of them are dead. And this isn't just happening in your village, it's happening everywhere simultaneously. The social fabric tears in ways that reveal just how thin the veneer of civilization actually is. Families abandon sick relatives because the fear of contagion is stronger than the obligation to care for your own. Priests who are supposed to administer last rites die in such numbers that there aren't enough clergy left to perform burial services. In cities like Florence, the bodies pile up so fast that they run out of consecrated ground to bury them in. They dig massive pits, plague pits, and throw bodies in by the hundreds, layered with lime to slow decomposition and stacked like cordwood because there's no other option. The doctors have no idea what's happening. Their entire understanding of medicine is based on humoral theory, the idea that disease comes from imbalances in bodily fluids. And nothing in that framework explains this. Some think it's bad air, miasmas rising from swamps or earthquakes. Some think it's divine punishment for sin, which leads to mass religious processions where people whip themselves bloody trying to appease God's anger. Some think it's astrological, unfortunate alignments of planets poisoning the atmosphere. None of it works because none of it's true. The actual cause is Yersinia pestis, a bacterium spread primarily by fleas on rats, though historians debate the exact transmission mechanisms and whether other factors amplified the spread. And then the violence starts, because when people are terrified and dying, and their entire worldview is collapsing, they look for someone to blame. In many European cities and towns, that blame falls on Jewish communities. The accusation is that they've poisoned wells or somehow caused the plague through conspiracy or witchcraft. In Strasbourg in February 1349, 2,000 Jews are burned alive. In other cities, entire Jewish quarters are massacred. Pope Clement VI issues bulls pointing out that Jews are dying from the plague too, which proves they didn't cause it. But the violence continues anyway, because terror needs a target. By 1352, the worst of the Black Death is over. The plague doesn't disappear completely. It will come back in waves for centuries, but the initial catastrophic surge has passed. Europe is left with mass graves, empty villages, abandoned fields, and a population that's been cut by a third to a half in just 5 years. And here's where the story gets interesting, because most people assume that's the end of it. Tragedy happens, survivors mourn, life gradually returns to normal. But that's not what happens at all. The Black Death doesn't just kill people and then fade away. It kills the old world and forces the survivors to build a new one. And the new world they build looks nothing like the one that existed before the plague arrived in Messina. Imagine you're a landowner in England in 1348. You own several manors, each with dozens or hundreds of peasants bound to your land through feudal obligations. They farm your fields, they pay you rents in labor and produce. And in exchange, you provide protection and allow them to farm small plots for their own survival. This system has existed for centuries. It's the foundation of the entire social order. Everyone knows their place, Everyone fulfills their role, and the hierarchy is so ingrained that questioning it seems as absurd as questioning the existence of the sun. Then the plague arrives, and within 6 months, half your peasants are dead. At first, you might think this is just your problem. You've lost workers. Your fields are going unplowed. But surely you can manage with the survivors working harder. But then you realize it's not just your problem. The lord in the next county has lost half his peasants too. So has the lord beyond him. So has every landowner in England, in France, in Italy, across the entire continent. And suddenly, the fundamental equation of the feudal economy has been inverted. Before the plague, labor was abundant and land was scarce. If a peasant complained about his conditions, you could replace him easily because there were always more people than there were plots to farm. But now labor is scarce and land is abundant. There are empty fields everywhere, abandoned villages, deserted manors. And the peasants who survived know this. They know they have leverage for the first time in their lives, and they start using it. A peasant approaches you and says he's thinking about leaving to work for the lord in the next county, who's offering higher wages and better conditions. Before the plague, you would have had him whipped for even suggesting it. But now, if he leaves, you can't replace him. There's no surplus labor waiting to fill his spot. So you have to negotiate. You have to offer him incentives to stay. Maybe you reduce his labor obligations. Maybe you convert some of his payments from labor to cash rent. Maybe you increase the size of the plot he can farm for himself. You're improvising, trying to keep your estate functional. And across Europe, thousands of landowners are doing the same thing. This is how feudalism starts dying. Not through revolution or philosophical enlightenment, but through the brutal arithmetic of labor scarcity after a pandemic. The numbers tell the story. In England, real wages for rural laborers increased by around 30 to 40% in the decades after the Black Death. In some regions, they double. Skilled artisans see even bigger gains because specialized labor is even scarcer. A mason, a carpenter, a blacksmith. If you have a valuable skill and you're one of the survivors, you can basically name your price. Cities compete for workers. Merchants need laborers to rebuild, to transport goods, to staff workshops. And workers start moving, migrating from areas with lower wages to areas with higher ones. Something that was almost impossible under the rigid feudal system, but becomes common afterward. The ruling class sees what's happening and tries desperately to stop it. In England, the Statute of Labourers is passed in 1351, attempting to freeze wages at pre-plague levels and restrict workers' ability to move. Similar laws are passed across Europe, governments trying to legislate away the new economic reality, to force the old system to continue functioning, even though the demographic foundation has been destroyed. But the laws don't work. Not really. Because you can't legislate against basic supply and demand. Enforcement is patchy. Workers evade the restrictions, and landowners who need labor are willing to ignore the law if it means keeping their estates productive. And then the tension explodes into violence. The English peasants' revolt of 1381 is the most famous example, but it's not the only one. In June 1381, thousands of peasants and workers march on London, demanding an end to serfdom, fair rents, and punishment for corrupt officials. They storm the Tower of London, execute the Archbishop of Canterbury, burn legal documents recording feudal obligations, and for several days control significant parts of the city. The revolt is eventually suppressed. The leaders are executed, and on the surface, it looks like the old order has been restored. But it hasn't. The genie is out of the bottle. Over the next century, serfdom gradually declines across Western Europe. Not because lords suddenly become enlightened and free their peasants out of moral conviction, but because the economic incentives have changed. It's more practical to have wage laborers or tenant farmers paying rent than to try maintaining the old system of bonded labor when workers have options. Eastern Europe goes a different direction. Their serfdom actually intensifies after the Black Death. But in the West, the plague has broken the feudal system's back, even if it takes another century for the body to stop twitching. There's an even bigger transformation happening that's harder to see in the moment, but becomes clear over decades. With fewer people and relatively more wealth per capita, because the total wealth hasn't decreased as much as the population has, survivors have more purchasing power. Cities grow because there are more opportunities for wage labor in urban areas. Trade expands. Craft production becomes more specialized. Some historians argue that the Black Death helped create the economic conditions that eventually led to the Renaissance, to the growth of banking and commerce, to the early stirrings of capitalism replacing feudalism. None of this happens because the plague was a good thing. It's not. It's a catastrophe that causes immeasurable suffering. But catastrophes don't just destroy. They also clear away old systems that were blocking new possibilities. And when survivors rebuild, they don't perfectly recreate what existed before. They improvise, they adapt, and sometimes they build something completely different. The Black Death rewired medieval Europe, not through anyone's plan or intention, but through the simple mechanical force of killing so many people that the old system couldn't function anymore. And once it stopped functioning, people discovered they didn't actually need it. Let's jump forward about 150 years and across an ocean, because the next pandemic that rewrites the world operates on a completely different scale, and with consequences that are even more devastating, even more permanent, and even more directly tied to the creation of the world we live in today. It's 1520, and you're living in Tenochtitlan, the capital of the Aztec Empire, one of the largest and most sophisticated cities in the world. The population is somewhere around 200,000 people, possibly more. The city is built on islands in Lake Texcoco, connected by causeways, with massive pyramids and temples, markets where thousands gather daily, and a complex system of governance that controls an empire stretching across central Mexico. Your world is stable, wealthy, and powerful. Then Spanish conquistadors arrive, led by Hernán Cortés, and they bring something far more deadly than their guns and steel swords. They bring smallpox. The disease probably arrives with one infected enslaved African person in Cortés's expedition. That's all it takes. One carrier introducing the virus to a population that has absolutely no prior exposure, no immunity, no resistance whatsoever. Within weeks, smallpox is spreading through Tenochtitlan. Within months, it's devastating the entire Aztec Empire. People are dying so fast that the living can't bury them. Entire families are wiped out. Villages are depopulated. The Emperor Cuitlahuac dies from it in 1520 after ruling for just 80 days. Here's what makes smallpox uniquely terrible in this context. It doesn't just kill random people. It kills densely packed populations especially hard, and it spreads before people even know they're infected. The Aztecs have no concept of this disease, no understanding of contagion, no medical framework for dealing with it. Their priests and healers try traditional remedies that do nothing. Their social systems, built around dense urban living and regular markets and gatherings, become accelerants for transmission. And the disease spreads ahead of the Spanish conquest itself, racing through trade networks, traveling faster than any army could march. The death toll is almost impossible to comprehend. Estimates vary wildly because record-keeping from that era is incomplete. But the best modern scholarship suggests that up to 90% of the indigenous population of the Americas died over the century following first contact with Europeans. 90%. Not from warfare primarily, though there was plenty of that. Not from slavery, though that was horrific too. From disease, smallpox especially, but also measles, typhus, and other old world pathogens that found virgin populations with no immunity. Think about what 90% population loss means for a civilization. It means every aspect of society collapses simultaneously. The agricultural system fails because there aren't enough people to farm. The military falls apart because warriors are dying faster than they can be replaced. The administrative structure disintegrates because the officials, the scribes, the people who keep records and collect taxes, they're dying too. Knowledge is lost because it's transmitted orally or through training that requires masters to teach apprentices, and both are dying before transmission can happen. When Cortés returns to besiege Tenochtitlan in 1521, he's not just fighting a weakened empire. He's fighting a society that's been hit by a biological weapon it can't defend against, and that's already halfway destroyed. The city falls, and while Spanish military tactics and indigenous allies play important roles, the decisive factor is that the Aztecs have been devastated by disease in a way that makes sustained resistance almost impossible. The same pattern repeats across the Americas. Francisco Pizarro conquers the Inca Empire starting in 1532, but smallpox has already swept through South America in waves, killing the Emperor Huayna Capac and triggering a civil war over succession. When Pizarro arrives, he's facing an empire already destabilized by epidemic disease. Throughout North America, indigenous populations are hammered repeatedly by waves of smallpox and other diseases, sometimes decades before Europeans even arrive in a region. The diseases spread through indigenous trade networks, racing ahead of the colonizers themselves. And here's the terrible connection that needs to be made explicit, because it shapes the next 3 centuries of history. The population collapse in the Americas creates a labor shortage that European colonizers fill through the transatlantic slave trade. Silver mines in Potosi, sugar plantations in Brazil and the Caribbean, tobacco fields in Virginia. All of these colonial enterprises need massive amounts of labor. Labor that was supposed to come from indigenous populations but can't, because those populations have been devastated by disease. So the colonizers turn to Africa, and the slave trade accelerates, ultimately transporting roughly 12 million enslaved Africans across the Atlantic before it ends. Smallpox doesn't cause slavery. Slavery exists in various forms across human societies before the Americas are colonized. But the demographic catastrophe in the Americas absolutely shapes how the Atlantic slave system develops and expands. It's a direct line. Pandemic disease destroys indigenous populations, creating labor shortage, driving demand for enslaved African labor, which fuels centuries of slavery and its long-lasting consequences that we're still dealing with today. So that's part 1 of the smallpox story, how it enabled European conquest and reshaped entire continents. But there's a second part that's equally important and actually offers something resembling hope. Smallpox becomes the first disease in human history that we completely eradicate. And understanding how we got from unstoppable killer that destroyed empires to extinct disease that exists only in laboratory freezers tells you a lot about how science and global cooperation can actually work when we decide something matters enough. The breakthrough starts earlier than most people realize. In the 18th century, people in various parts of the world, China, India, Africa, the Ottoman Empire, practice variolation, deliberately exposing people to small amounts of smallpox material to induce mild infection and immunity. It's risky. Some people die from variolation itself, but it's much safer than catching smallpox naturally. Lady Mary Wortley Montagu, wife of the British ambassador to the Ottoman Empire, sees variolation practiced in Constantinople, has her own children inoculated, and introduces the practice to England in 1721. Then, in 1796, Edward Jenner makes the crucial observation. Milkmaids who catch cowpox, a related but much milder disease, don't get smallpox. He tests this by deliberately infecting a boy with cowpox material, then later exposing him to smallpox. The boy doesn't get sick. Jenner has discovered vaccination named after vacca, the Latin word for cow. It's one of the most important medical discoveries in human history. But having a vaccine and actually eradicating a disease are two completely different challenges. Smallpox continues killing people throughout the 19th and early 20th centuries. In the 20th century alone, before eradication, smallpox kills an estimated 300 million people. 300 million. It takes global coordination, massive resources, and decades of sustained effort to finally eliminate it. In 1958, the World Health Organization proposes global smallpox eradication. In 1967, they launched the Intensified Smallpox Eradication Program with a focused strategy, mass vaccination campaigns combined with surveillance to detect outbreaks early and ring vaccination around cases to contain spread. It works. Country by country, region by region, smallpox transmission is interrupted. The last naturally occurring case is in Somalia in 1977. In 1979, WHO certifies that smallpox has been eradicated globally. In 1980, the World Health Assembly officially declares smallpox eradicated, the first and still the only human disease we've completely wiped off the planet. This matters beyond just smallpox. It proves that global cooperation on health is possible and effective. It creates the template for other eradication campaigns. Polio is close. Guinea worm is nearly gone. It establishes WHO as a legitimate force for international health governance. And it shows that we can take a disease that helped conquer empires and destroy civilizations, and we can hunt it down until it doesn't exist anymore, except in laboratory samples, maintained under strict containment. From invisible empire builder to extinct disease, that's the arc of smallpox. And both halves of that story reshaped the world. Fast forward to 1918, and the world is different in almost every way, from the medieval Europe that faced the Black Death, or the Americas that encountered smallpox. There are nation-states with massive bureaucracies. There's modern medicine, germ theory, understanding of transmission. There are trains and steamships connecting continents, telegraphs and telephones allowing communication across distances that would have been impossible centuries earlier. There are armies numbering in the millions fighting the First World War, the most industrialized, most devastating conflict humanity has ever seen. And then, in the middle of this war, a new disease emerges that will kill more people than the war itself. The 1918 influenza pandemic, commonly called Spanish flu, even though it definitely didn't originate in Spain, is different from the Black Death and different from smallpox in ways that shape how societies respond and what changes afterward. It spreads faster than any previous pandemic because the world is more connected. It infects roughly 1/3 of the global population, around 500 million people. And it kills approximately 50 million, with some estimates going higher. But here's what makes Spanish flu uniquely devastating and particularly relevant for understanding societal impacts. It kills young adults preferentially. Most diseases hit the very young and the very old hardest, the people with weaker immune systems. Spanish flu does that too, but it also shows a bizarre mortality spike for people aged roughly 20 to 40. The mortality curve looks like a W instead of the normal U shape, and nobody at the time fully understands why. Modern research suggests it might be related to the strength of immune response itself, where healthy immune systems overreact and cause more damage. But in 1918, this pattern is just a terrifying mystery. Think about what it means for a society when the disease disproportionately kills young adults. These are your workers, the people in factories, in fields, in offices. These are your soldiers, your new parents, your most economically productive demographic. When the Black Death killed everyone more or less equally, it was catastrophic, but it maintained the demographic structure. When Spanish flu kills young adults specifically, it punches holes in the workforce and family structures that take a generation to recover from. The numbers are staggering. In the United States, life expectancy drops by about 12 years in 1918 because so many young people die. In India, estimates suggest 17 million dead, potentially more. In some indigenous communities in Alaska and the Pacific Islands, entire villages are wiped out. 50, 70, 90% mortality in isolated populations hit by a disease they have no resistance to. People go to sleep healthy and die within hours or days. Cities are overwhelmed, morgues fill up, mass graves are dug again, just like in the plague centuries earlier. But this time, with modern newspapers documenting it, with photographs recording the horror. And it happens fast. The pandemic has 3 main waves: spring 1918, fall 1918, and winter 1919. The deadliest is the second wave in fall 1918, when the virus has apparently mutated to a more lethal form. Entire families die within days of each other. Hospitals are overflowing. Medical staff are dying from the disease they're trying to treat. There's no vaccine, no antibiotics for secondary bacterial infections, very limited treatment options. Public health responses vary. Some cities close schools and ban public gatherings. Others don't. Philadelphia holds a massive war bond parade in September 1918, despite health warnings. And within days, the city's hospitals are overwhelmed with thousands of cases. Here's where the story gets interesting in terms of how pandemics change societies. The war shapes how governments respond, and their response shapes what information people get. Most of the countries fighting World War I are operating under wartime censorship. Reporting on disease outbreaks, especially if they suggest the military or civilian populations are weakened, is suppressed because it could hurt morale or give intelligence to the enemy. France, Germany, Britain, the United States. They all downplay the pandemic's severity in official communications. But Spain is neutral in the war. Spanish newspapers report on the flu outbreak freely. King Alfonso XIII gets sick, and Spanish papers cover it. So from outside, it looks like Spain is being hit especially hard, and the pandemic gets named Spanish flu, even though evidence suggests it probably originated somewhere else. Possibly Kansas, possibly China, possibly France. The actual origin is still debated. But the point is that the name sticks because of information politics during wartime. It's the first pandemic where propaganda and censorship play major roles in shaping public perception. The war also affects the pandemic's spread. Troop movements accelerate transmission. Soldiers crowded in barracks and trenches, traveling on trains and ships, going home on leave. They carry the virus across continents. Military camps become incubators for the disease. And when the war ends in November 1918, demobilization means millions of soldiers returning home, bringing the flu with them into communities that might have been partially spared. By 1919, the pandemic is winding down, not because of any intervention that worked, but because the virus burns through susceptible populations, and enough people have been infected that transmission slows. The total death toll exceeds anything from the war itself. Perhaps 17 million military and civilian deaths from World War I compared to 50 to 100 million from the flu. And the world that emerges is shaped by both catastrophes layered on top of each other. The pandemic drives changes in public health infrastructure that last. Many countries establish or strengthen national health ministries. There's more focus on disease surveillance, on tracking outbreaks, on building systems to respond quickly. The idea that governments have responsibility for public health, not just for defense and taxation, but for monitoring and preventing disease, becomes more accepted. The League of Nations, created after World War I, establishes a health organization that's a precursor to WHO. But there's also something else. A strange forgetting. Spanish flu kills more people than the war, but it doesn't occupy the same space in collective memory. The war is commemorated with monuments, with memorial days, with literature and art. The flu gets forgotten relatively quickly, buried under the relief of peace and the desire to move forward after years of catastrophe. It's only much later, especially after COVID-19, that historians and the public start seriously examining what Spanish flu meant and what it changed. What it changed was this. Governments learned that disease could threaten national security as seriously as military invasion. That lesson would shape public health for the next century, even if the pandemic itself faded from popular memory. Now we get to the pandemic we all lived through, and the challenge here is not explaining what happened, you remember what happened, but understanding what changed, what's still changing, and how COVID-19 fits into the pattern of pandemics rewiring societies. It's late 2019, and a novel coronavirus emerges in Wuhan, China. By January 2020, it's spreading internationally. By March, WHO declares it a pandemic, and by April, roughly half the world's population is under some form of lockdown. In the span of a few months, the world changes more dramatically than at any point since World War II. Not in terms of death toll. COVID's mortality rate is much lower than Spanish flu or the Black Death. But in terms of how quickly and completely it disrupts normal life across the entire planet simultaneously. And here's what makes COVID different from every previous pandemic. It's the first one that happens in a fully networked, digitally connected world. The Black Death spread along medieval trade routes at walking or sailing speed. Spanish flu spread via trains and steamships. COVID spreads via international flights, goes viral on social media before it goes viral in populations, and gets responded to through digital systems that simply didn't exist before. Let's break down the specific ways COVID rewires systems, because this is where you see the pandemic not just disrupting things, but actively forcing changes that would have taken years or decades to happen gradually. First, work. In 2019, most office workers physically commute to offices to do work they could theoretically do from home, but nobody really does because that's not how work works. Remote work exists, but it's niche. Maybe 5 to 7% of workers primarily work from home in the US. Then March 2020 happens, and suddenly anyone who can work remotely is forced to do so. By spring 2020, roughly half of American workers who can work from home are working from home. This isn't a gentle transition. This is millions of people suddenly trying to do video calls on Zoom, setting up home offices in bedrooms and closets, figuring out childcare while working, dealing with internet bandwidth problems, learning new software, adjusting to the complete absence of physical separation between work and home. For many people, it's stressful, isolating, and exhausting. For others, it's a revelation. No commute, more flexible schedules, ability to live anywhere rather than near an office. And here's the key point. It doesn't fully revert after vaccines and lockdowns end. As of 2024, hybrid work is standard in many industries. The percentage of workers primarily working from home has stabilized at much higher levels than pre-COVID. Commercial real estate in downtown cores is struggling because companies don't need as much office space. Commuting patterns have changed. Even companies that want to bring everyone back find they can't fully force it because workers have experienced the alternative and many prefer it. COVID broke the assumption that office work must happen in offices, and that assumption isn't coming back. Second, cities and urban planning. When you suddenly can work from anywhere, where do you live? During COVID, there's significant migration from expensive, dense cities to cheaper suburbs, smaller cities, or rural areas. People move from New York to Florida, from San Francisco to Austin or Boise, from urban cores to the exurbs. Some of this reverses later, but not completely. Housing prices in remote work-friendly cities spike. Demand for single-family homes with space for home offices increases. The idea that you must live near your job, which has shaped urban development for more than a century, gets disrupted. Third, digital acceleration. In 2019, telemedicine exists, but it's a tiny fraction of healthcare. By 2020, it explodes because people can't or won't go to doctors' offices for routine visits. Virtual schooling goes from rare to universal almost overnight and reveals massive inequalities in internet access, device availability, and home environments for learning. Online shopping, already growing, accelerates by years in a few months. Contactless payments become standard. QR codes for restaurant menus and vaccine passports become ubiquitous. The infrastructure of daily life gets digitized faster than anyone planned. Fourth, inequality and the K-shaped recovery. This might be the most important long-term impact. COVID doesn't hit everyone equally. It never does with pandemics. But the specific patterns matter. People who can work from home generally keep their jobs and incomes. People who work in service industries, retail, restaurants, entertainment, they get laid off or furloughed. Wealthy students continue learning with minimal disruption. Poor students, especially those without internet access or quiet study spaces, fall behind educationally in ways that will affect them for years. The pandemic also reveals and amplifies inequality in who dies. In the US and many countries, COVID mortality is much higher in poor communities, in communities of color, in places with less access to healthcare, in dense housing situations where isolation is impossible. Essential workers, grocery clerks, delivery drivers, nurses, meatpacking workers can't work from home and face much higher exposure risk. The wealthy isolate in comfortable homes. The poor keep working in high-risk settings because they have no choice. And the economic recovery reflects this. Stock markets bounce back quickly. People with investment portfolios and homes see their wealth increase. People without those assets, who lost jobs or businesses, struggle. It's called a K-shaped recovery. Some people go up, others go down, and the gap widens. Fifth, surveillance and state power. Governments worldwide implement contact tracing apps, vaccination passports, travel restrictions, mandatory quarantines, enforcement of mask mandates, and capacity limits. Some of this is necessary public health response. Some of it normalizes levels of surveillance and control that would have been resisted before COVID. The long-term question is which emergency powers persist after the emergency ends, and we're still figuring that out. Sixth, the environment. During lockdowns, carbon emissions drop sharply but temporarily. Pollution levels in cities fall. Wildlife moves into urban areas that are suddenly quiet. But as economies reopen, emissions bounce back. The long-term environmental impact of COVID is complicated. There's more delivery driving, more single-use plastics for safety, but also more remote work, reducing commuting. The net effect is still being calculated. What all of this adds up to is a world where COVID didn't just kill people, though it killed millions, but rather forced changes in how we work, learn, shop, socialize, and think about public health and government power. Some of these changes were long overdue. Some were forced on populations that weren't ready. Some are genuinely improvements. Some have opened doors to new problems. And the critical difference between COVID and earlier pandemics is that we experienced this one with the ability to analyze it in real time, to document it constantly, to argue about it on social media, to produce enormous amounts of data about every aspect of the pandemic's impact. We're not looking back centuries later, trying to understand what changed. We're living through the changes, watching them happen, debating which ones to keep and which ones to reverse. The rewiring isn't finished. We don't know yet which COVID era changes become permanent features of society and which ones fade. But we absolutely know the world isn't the same as it was in 2019, and it's never going back to being that world. Just like every other pandemic before it, COVID reached into the machinery of civilization and rewired it. We're just closer to the moment of change, so we can see the wires being reconnected in real time. So now we've walked through 4 pandemics, separated by centuries, each one playing out in completely different contexts, with different diseases, different technologies, different social systems. The Black Death hitting medieval Europe, smallpox devastating the Americas, Spanish flu striking during the First World War, COVID-19 disrupting our digitally connected present. What connects them? What patterns repeat across diseases and eras? Pattern 1. Pandemics redraw the population map in ways that shift power, When the Black Death kills a third to half of Europe's population, it doesn't just create grief and trauma. It creates labor scarcity that forces feudal lords to compete for workers, that allows surviving peasants to demand higher wages and better treatment, that accelerates the transition from feudalism to wage labor and eventually capitalism. Population loss becomes economic leverage. When smallpox kills up to 90% of indigenous Americans over a century, it doesn't just cause death. It enables European conquest by destroying the demographic foundation of indigenous empires, and it creates the labor shortage that drives the expansion of the Atlantic slave trade, with consequences that last centuries. When Spanish flu kills young adults preferentially, it punches holes in the workforce and family structures that take generations to recover from. When COVID-19 hits elderly populations and people with comorbidities hardest, it affects pension systems, healthcare costs, and the demographics of political power. Every pandemic changes who lives, who dies, and how many people exist in which age groups and which regions. And those changes ripple through economics and politics for decades afterward. Pattern 2. Pandemics strengthen or transform the state. Before the Black Death, European states are relatively weak institutions, with limited ability to control populations or collect information. After repeated plague outbreaks, states develop quarantine systems, port inspections, bills of health, and bureaucracies to enforce them. The modern state's interest in controlling borders and monitoring populations is partly born from plague control. After Spanish flu, governments establish or strengthen national health ministries, create systems for disease surveillance and reporting, and accept that public health is a government responsibility. The League of Nations creates a health organization. Later, WHO is established with the explicit goal of coordinating global health responses. After smallpox, the successful eradication campaign proves that international cooperation under institutions like WHO can actually work to solve massive global problems, creating precedent for other coordination efforts. During COVID-19, governments exercise emergency powers at scales that would have been unthinkable before. Mandatory lockdowns, travel restrictions, business closures, vaccination requirements, contact tracing. Some of these emergency measures persist after the emergency, expanding what's considered acceptable state intervention in daily life. Pandemics force governments to choose between letting people die or exercising more control, and they usually choose control. Whether that control is benevolent public health or the foundation for authoritarianism depends on the specific context, but the expansion of state power is consistent across pandemics. Pattern 3. Pandemics accelerate science and medicine. The Black Death destroys confidence in ancient medical theory and creates conditions for questioning traditional authorities, contributing indirectly to the later scientific revolution. Smallpox drives the development of variolation and later vaccination. Jenner's smallpox vaccine is arguably the most important medical intervention ever invented. The successful eradication campaign proves that science can actually eliminate a disease completely, not just treat symptoms, but erase the disease from existence. Spanish flu pushes advances in virology, in understanding how respiratory diseases spread, in developing public health infrastructure for tracking and responding to outbreaks. COVID-19 accelerates mRNA vaccine technology by perhaps a decade, forces massive investment in genomic surveillance and variant tracking, pushes telemedicine forward by years, and generates unprecedented amounts of epidemiological data that will feed research for decades. Every pandemic reveals gaps in medical knowledge and creates urgency to fill those gaps. The diseases that kill millions become the focus of resources and attention that lead to breakthroughs, sometimes immediately, sometimes decades later. Pattern 4. Pandemics expose and amplify inequality. The Black Death hits everyone, but the wealthy can flee to country estates, while the urban poor stay packed in cities where transmission is faster. Jewish communities get scapegoated and massacred. The poor get the worst care and die in higher numbers. Smallpox devastates indigenous populations in the Americas far more than Europeans because of prior exposure and immunity differences. The demographic collapse enables colonization and slavery, creating systems of racial inequality that persist for centuries. Spanish flu hits some populations much harder than others. Indigenous communities in Alaska, poor neighborhoods in cities, places with crowded housing and limited medical care. The young adult mortality spike affects working-class families more because they can't afford to isolate the way wealthy families can. COVID-19 kills people without access to quality healthcare at much higher rates. Essential workers face higher exposure. Students without internet access fall behind. The economic recovery benefits asset owners, while workers in service industries struggle. The pandemic reveals and widens the gaps between rich and poor, between countries with robust healthcare systems and countries without. Pandemics don't create inequality from nothing. They find the existing cracks in society and hammer them wider. They reveal who's protected and who's vulnerable. And the societies that emerge after the pandemic often carry those exposed inequalities forward, sometimes using the crisis to justify existing hierarchies, sometimes using the exposure to push for change. These four patterns, demographic redistribution, state transformation, scientific acceleration, and inequality exposure, show up again and again across centuries and continents. The specific mechanisms differ. The technologies change, but the basic dynamics of how pandemics rewire societies repeat because they are driven by fundamental realities of how diseases spread, how governments respond, and how social systems handle catastrophic shocks. So here's what we know. Pandemics don't just interrupt history for a few years while people die, and then everything goes back to normal. They force resets of social systems, sometimes partial, sometimes complete. They break assumptions about how society must function, and when people rebuild, they don't perfectly recreate what existed before. Sometimes they build something better. Sometimes they build something worse. But they always build something different. The Black Death helped kill feudalism in Western Europe, not through revolution, but through the brutal arithmetic of labor scarcity, forcing lords to negotiate with peasants who suddenly had leverage. The world that emerged, with wage labor, greater social mobility, eventually Renaissance humanism and early capitalism, grew out of the space the plague cleared. Smallpox enabled the conquest of the Americas and forced the creation of global health systems. The catastrophe of 300 million deaths in the 20th century led to the successful eradication campaign, proving that international cooperation and science can actually eliminate a disease completely. The worst killer became the blueprint for how to win. Spanish flu killed more people than World War I, hit the young, and changed how states think about public health as essential infrastructure, not optional charity. It created the foundation for global health governance through the League of Nations Health Organization and later WHO. COVID-19 is still rewriting the code. We're watching it happen in real time. The shift to remote and hybrid work, the acceleration of digital everything, the exposure of inequality, the expansion of state surveillance and control, the rapid development of new vaccine technologies. All of these are transformations forced by the pandemic that won't fully revert even after the immediate crisis passes. The question that matters now isn't when do we go back to normal, because there is no going back. The question is, what kind of world are we building in the space that COVID blew open? Are we using the forced digitalization to create more flexibility and work-life balance, or to extend surveillance and control? Are we addressing the exposed inequalities in healthcare access and essential worker protections, or accepting them as permanent features? Are we maintaining the scientific investment that created mRNA vaccines so quickly, or letting it fade once the urgency passes? Are we learning from the pandemic to build more resilient systems, or just waiting for the next crisis to break things again? These aren't hypothetical questions. Societies are answering them right now through policies, investments, social norms, and individual choices. The reset is happening whether we direct it consciously or let it happen through the accumulated force of uncoordinated decisions. Every pandemic we've looked at proves the same thing. The world after is never the same as the world before. The dying eventually stops. The bodies get buried. Life continues. But the life that continues happens in a reorganized world with different rules, different expectations, and different possibilities. That's what pandemics do. They're not just medical events that kill people and then fade into history books. They're forced updates of the system, brutal, unwanted, catastrophically expensive in human lives, but impossible to roll back once they've happened. The real story of pandemics isn't the suffering, though that's real and massive. It's what we build afterward with the pieces that survive, and whether we build something that makes the next catastrophe less devastating, or whether we just rebuild the same vulnerabilities that broke the first time. 4 pandemics, 4 moments where disease punched civilization in the face and forced it to change. The Black Death that killed feudalism along with millions of peasants. Smallpox that destroyed empires and eventually got destroyed itself. Spanish flu that hit the young and taught governments that public health is national security. And COVID-19 still rewiring how we work, learn, and think about the balance between safety and freedom. History doesn't repeat itself, but it definitely has patterns. And the pattern with pandemics is clear. They don't just kill and fade. They break systems, force adaptations, and create the conditions for whatever comes next. Sometimes better, sometimes worse, never the same. If this kind of deep historical analysis, the kind that looks at why things changed, not just what happened, is valuable to you, subscribing helps me keep making these. There are more stories like this, more moments where crisis and human response collided to create the world we inherited. They're not always comfortable stories, but they're the ones that explain how we got here and what we can learn for what's coming. Thanks for being here. Thanks for sitting through an hour about disease, death, and transformation. Remember the 50 million who died in the Black Death, the 300 million killed by smallpox before we eradicated it, the 50 million who died in Spanish flu, and the millions who've died from COVID. Their deaths changed the world. The question is, whether we learn from those changes or just wait for the next pandemic to teach us the same lessons all over again. See you in the next one.